Good afternoon, everybody. Happy Friday afternoon. Still a nice sunny day out there. Got a couple of things to visit with you about today. We're going to talk about the COVID numbers. We're going to talk about vaccinations. And then, of course, we will take your questions. So, COVID numbers in the city of St. Louis. We're running on average, 7-day average, about 77, 78 new cases per day. 77, 78 new cases per day in the city of St. Louis. It's still high, but it's down considerably from what it was even 10 days ago, where we were running on average 120, 130. So these last 7 days, I guess, have really all been below 100 cases, all but one day, which hit 104. So that's the reason that the average is down to about 78 cases per day. That's good. It's, it's certainly a result of people continuing to take COVID serious, that it is very contagious, and wearing their mask, hand washing, social distancing. It's also, we are beginning to see people begin to get vaccinated, and we'll talk a little bit more about that, and that's in the region. People are getting vaccinated, and people here in the city of St. Louis as well. So we'll talk about vaccinations just in a minute. Let me talk to you a little bit about the hospitalization numbers. So yesterday, these numbers run 2 days behind, so this is Friday. These are from Tuesday or Wednesday. Yesterday there were 676 people in the hospital, either COVID positive or suspected positive. That's as low as it's been in quite a while, being down below 700. So 676, if you look back to, say, that's January 21st, if you look back to what we reported on December 21st, we were at 946. So that's not quite 300 different down. If you look back to where we were, say, on November 21st, and you take a little bit of a long view here, we were at 980. And you look back to where we were on October 21st, we were at 476. So we've gone 476, 980, what did I say, 946, and today 676. So we're down, but still fairly high. But that's, of course, good news. Take good news where you can get it. In terms of number of people in the ICU, there are still 126 people that are in the ICU. That's of the 676, and of those people, 87 are on ventilators. So, still very serious, a number of people that are in the hospital and who are very seriously ill. Patients admitted to the hospital, 7-day average is about 92, 93 per day on a 7-day average. Yesterday it was 87. And coincidentally, I guess 87 people discharged as well on that day. So a number of cases are coming down. The hospitalizations lag that a bit, but the number of hospitalizations are coming down. And at the same time, we are beginning to see people get vaccinated. Not as many as we would like, but we know that the VA, for example, anyone who's a veteran who's over 65 or with an underlying health condition can get vaccinated through the VA. I've known a number of people who have done that. Some other federal agencies do have vaccines, and they are vaccinated their folks. Hospitals have invited to be vaccinated all of their healthcare workers. They are moving on to vaccinating healthcare workers who are not in hospitals, but nevertheless patient-facing. So that's helping the situation. Here in the city of St. Louis, I know you've heard a lot about vaccinations in the city of St. Louis, but some good news to report. This week on Tuesday, St. Alexius vaccinated about 108 of our EMS EMTs, paramedics, firefighters. On Wednesday, they had, and because they got vaccine for their employees as well, of course, on Wednesday they vaccinated about 200. So on Tuesday and Wednesday, we got about 300, a little over 300 EMT, EMS firefighters vaccinated. Today, that was through St. Alexius. Today, we are vaccinating about 400 people at fire department headquarters, and that includes fire department firefighters who want to be vaccinated. It included, look at my list here, firefighters, about 100 police officers from the airport, people who work in our morgue. Who else? I think people who, sheriffs, some sheriffs got vaccinated today. That's still going on probably at this point. They're about ready to wrap up. I was there this morning for an hour or so. And this was able to take place, vaccinating our first responders, through both federally qualified health center, BJC, who had been storing this vaccine, and an entity called MyVax, MyVax, and they have a related company called Eagle Force, and they are here in town. They had about 10 vaccinators here on site vaccinating our folks. This is a partnership that we've had for a while with MyVax, but of course it's expanded a lot at this point in time. MyVax is an entity, national entity that records vaccinations and keeps track of all that for folks. One of the other things that occurred today is that, well, let me back up and say, a month ago or a few weeks ago, the city of St. Louis ordered and received 8,000 saliva-based COVID tests. And so we administered that to our firefighters, police officers, because we know that people can be asymptomatic. We know there were a few people who tested positive to that who were asymptomatic. So that was a good thing to be able to do, because it comes back within 48 hours, and we were able to very quickly quarantine them so that they were no longer spreading the coronavirus. So today at the vaccine center, both the saliva test was available to those people who had not already had it, and then the vaccine as well. So I think it's a really good model for us to continue to use. We believe that we are going to get 3,900 doses next week, Tuesday, Wednesday, from Pfizer. We're holding our breath a little bit on that, of course, but we believe that that's going to happen. And when it does, we expect towards the end of next week to continue to vaccinate the rest of our first responders, which is police officers, people who work in labs, firefighters who didn't make it into this group. So we're going to vaccinate our first responders and people that are in direct contact with the public. And so we expect that to be towards the end of next week. That's good news, because first responders are certainly at the top of the list. And for our first responders who have been out there since March, they are, of course, still out there and still being exposed to COVID. So we really want to get them vaccinated as soon as possible. We are encouraging all of them to get vaccinated. Of course, it's voluntary. But as that happens, as more and more people are vaccinated, and as people continue to follow the mitigation strategies, we expect to continue to see our numbers go down, and meaning new cases, hospitalizations. You know that we have several metrics that are set up. One is we want to see new cases in the city of St. Louis drop below 35. We want to see hospitalizations, new admissions to the hospital in the region drop below 40. We want to see our positivity rate under 5%. It's around 10% right now, but it was up as high as almost 20, so it's around 10% right now. and we want to see fewer than 350 people in the hospital, COVID related. So, we're still about double that number today at 676, but wasn't very long ago that we were triple that number. So all of these things are coming together. This is a matter for all of you and for me, frankly. We have to manage our expectations on this. Many of us, I wouldn't say we all, but most people want to get this vaccine, want to get the vaccination as soon as possible. We know the supply is difficult. It's not just a supply of the vaccine. You've got to have the syringes. You've got to have all the other related medical supplies that go with that. And so, I think we just all have to continue to follow the mitigation strategies for now until we can get in line to get the vaccine. People have asked me, have I had the vaccine? No. I have not been vaccinated. I am not going to be vaccinated, even though, as we all know, I'm over 65, but I am not going to be vaccinated until every single one of our first responders in the city is vaccinated or has the opportunity to be vaccinated. I am not going to jump that line. So people ask me that constantly. So when all the policemen, policewomen, firefighters, when all those folks have had the opportunity, then I'm going to consider getting vaccinated. So I think that's all is that all I needed to talk about today?
I think so.
Okay. Now for your questions.
Couple of questions. Justine's question, 11 p.m. closing time, bars and restaurants. When will the city be in a position to begin talking about lifting that for businesses?
Justine, when we meet those metrics that we've been talking about, certainly we will change that 11 p.m. closing time. Whether we'll be able to change it before that or not depends on what the trajectory looks like. I'm going to be honest with you. I want to lift it as soon as is safe to do so. I want as many people to be able to go to work in that industry and to go out and have fun in that industry as possible. If we keep doing things right, and the vast majority of our businesses are doing things right, if we keep doing things right, and if more people keep getting vaccinated, it should come together that our numbers come down, hopefully rapidly, but we got to see what those numbers are.
Question about zip codes and neighborhoods and hotspots. Are there particular areas in the city of St. Louis that you are most concerned about right now?
Concerned about the whole city, of course. So this is on our website. That's why somebody brought me the computer over here to look at. 63116 still has the highest number of cases, and this is number for the last 2 weeks. It's not forever, but in the last 2 weeks. 63116 has had 149 new cases in the last 2 weeks, from the 8th of January till the 21st. Last 14 days. Sorry about that. 63109 had 85 cases. 63139 had 77 cases. 63110 had 67. 63118 had 63. These zip codes have pretty consistently over the last few months had the highest number of cases. Now, they are also densely populated areas. So these are number of cases. But yeah, and we still believe that a lot of this spread, of course, is happening among family members and neighbors and people getting together and feeling comfortable and maybe not socially distancing and wearing their mask. So.
Okay, on the vaccination front, Pat and some others have questions about general public vaccinations, which is phase 3 under the state of Missouri. Mm-hmm. What kind of time frame do you think we're looking at for when it becomes more widely available?
Pat, I wish I knew the exact answer to give you. But as you know, I'm gonna get my papers out here so I don't mess this up. But we are currently in phase 1A, and but the people right now that are authorized or allowed to take the vaccine are people in phase 1A, which is, what do I got here? Law enforcement, fire department, corrections, emergency management, emergency service, and public health. People in tier phase 1, I'm missing a piece of paper here. That's my own fault. That's phase 1B tier 1 that I just told you. 1A was hospital workers. Okay, so that's hospital workers. I just told you phase 1B, and the other people that are allowed now is phase 1B tier 2. Who's that? People over 65 and adults 18 to 64 with underlying health conditions such as cancer, chronic kidney disease, COPD, sickle cell, pregnancy, severe obesity, very serious underlying health conditions. Those are the folks right now that are authorized to get the vaccination. That in the state of Missouri is 2.5 million people, is the estimate. In the city of St. Louis, the people currently authorized to get the vaccination is probably around 80,000 people. That accounts for the 41 or 2,000 people that are over 65 who live in the city, and approximately another 40,000 people between the ages of 18 and 65 who have underlying health conditions. So it will be a while before we vaccinate or offer the vaccine to 80,000 people and get all of those who want it done vaccinated. So I'm hearing that it's a few months probably before somebody who's not in those categories actually is eligible.
Kat's question, another vaccine question. How does the health department in the city working to make sure that vaccine and notifications get to folks like senior citizens, homebound, people who don't necessarily have an easy time getting out?
Right. So, first of all, in the first tier, in the first phase, nursing homes and nursing home workers were in that first phase. So most of them either have been, or at least they've had the opportunity to be vaccinated. People that are homebound, the city does know who a lot of those folks are and will have a plan to get them vaccinated as well, because obviously they can't come to a mass vaccination site, which is something that we expect to be able to do in the not too distant future. Everybody wants more vaccine. That includes us. You may have seen, I saw this on the news last night, that I think New York had some dozen or 15 mass vaccination sites planned for this weekend. They had to cancel them because they don't have the vaccine to do it. So this is a struggle everywhere, but it's a day-to-day thing. It's better today than it was a week ago when I visited with you about this. And I think it's going to continue to get better, but we're just all going to have to exercise a little bit of patience.
Stewart's question has to do with masks, Mayor. As vaccinations continue to ramp up in the city, the state, and the country, how much longer do you think the public is going to be required to wear masks and face coverings?
Well, what they're saying right now is until we obtain some level of, some decent level of herd immunity, and I don't know exactly when that's going to be, but I hope it's, this summer. I don't really know the answer to that question, but I know everybody wants to quit having to wear these masks, but this is for me, this is a very minor inconvenience and worth it in order to stop the spread of COVID and the flu and other sorts of things. So I think it'll be a little while.
Jacqueline's question, Mayor, has to do with the hospitalizations that we talk about. Does the city or the task force, the pandemic task force, monitor if COVID-19 patients going into the hospital are repeat patients or repeat infections of COVID-19?
I believe the hospitals monitor that. I don't have those numbers right now. I do know that hospitals try very hard not to have people readmitted for what they went in for the first time, but sometimes that occurs. Most folks will say to you, if you don't really need to be in the hospital, you don't want to be there. That's not a situation you want to be in if you don't have to. So There are, I'm sure, some people who have had to go back to the hospital that were discharged, but that's not something that I'm personally tracking.
So last question, unrelated topic, about the reorganization. This is from Kayla about the reorganization and neighborhood-based approach to SLDC. I'm excited for the new approach. She says, what does implementation look like, when, and what do you anticipate the results will be of this new approach?
It's a big question, Kayla. Kayla,
Don't have a last name.
okay. So, the implementation, this hasn't been completely accepted or adopted yet. It's being presented. It was presented this week to the Board of Aldermen. It's being presented, it was presented to St. Louis Development Corporation. We are going to have a new leader at the St. Louis Development Corporation. We don't know who that's going to be at this time. But Otis Williams, who has been there for a long time and done a terrific job, is retiring at the end of April or middle of April. And so we will have a new leader there. And that's all the more reason, we rolled out in October of I guess it was October of 19. Yeah, October of 19. We rolled out this new planning process. And, we had hoped that it would be done within a year. COVID messed that up. And so it was very important for us to get this finished, adopted, out there, to be implemented over the next few. I'm sure it'll take a year to fully implement this. There are some new positions. The city has to step up and provide some funding to SLDC, some general revenue funding. I'm in complete support of that. Having said that, I know what the budget looks like. There are a lot of things I'm in complete support of that we don't have the funding for. So we'll try to provide some funding for that this year as the budget is prepared, but ultimately that budget will be adopted by the July 1st. Hopefully that will occur. The new positions can be filled. Some of them people will transfer to different positions, but I would hope that within a year we'll have an in-place, intact, reorganized SLDC.
And last new question of the day, Kimberly is asking, you mentioned the population group of 18 to 65 in St. Louis with underlying health conditions.
Mm-hmm.
Asking about vaccinations for that group, do you think it's weeks or months?
I think it's weeks, but fingers crossed here. I think it's weeks because right now, you're already eligible to get it, but most likely, and if you do have that underlying health condition, hopefully you have registered with your hospital system or multiple hospital systems so that when they have vaccine, they can notify you and you can make an appointment. So you fall in the same category if you're 40, let's say, and have serious underlying health condition, you fall into the same category of eligibility as someone who's over 65. So I don't, that's not going to be too long.
I think that's
It's
it.
just depending on if we have the vaccine.
I think that's it for questions today, Mayor.
Good. Thank you all. Appreciate it. Have a great weekend. I think the weather's going to change a little bit here, but for right now, it's a beautiful day outside. Have a good weekend. Everybody stay safe. Wear your mask. And appreciate you being with us. We'll be back with you next week. Thanks.